Welcome. Okay. Okay, friends. Again, since these are revision lectures, I am trying to cover things which are important from the point of view of theory as well as practical in the Viva. Investigation of an epidemic is constantly asked in theory as well as in Viva. It will be asked regularly. Please ensure that you know this topic thoroughly. I don't know, we keep on repeating these topics, but unfortunately, what happens is that y'all tend to neglect simple topics like this investigation of an epidemic, very simple topics, and you tend to waste your time trying to remember things which hardly ever come in the exam. So please be thorough on investigation of an epidemic. It is always either it will be asked in your viva or in your theory. It will be asked. So please ensure that you know it well. And it's a very short topic. And I'll try and explain to you exactly what is to be done in investigation of an epidemic. If you've got doubts, please message me or speak to me about any problems which you have in your complete curriculum. If there's anything which you'll want me to take separately, again, please ask me, because I find that most of you during the examination are unable to answer the questions, very simple questions. So please read up your topics. If there are doubts, ring us up. Since your exams will be held, let me announce the fact that if your exams are held here in the college, I mean, wherever the exams will be held, I will be an examiner. And if it is held in this college, Inakshi will be an examiner. So you require to, if you got your problems, any of these things, please ask us. Ring us up, ask us, and get your clarification done. Do not wait till the last minute. Anyhow, the other thing which I would like to tell you is the moment things open out, we will have a end of the year exam which is there, which will or what do you call a prelims or whatever you want to call it, and which will permit you to sit for your final exam. So please prepare for your final internal examination, which is there. The complete syllabus will be involved, so get yourself ready. I am expecting that we will have the college reopening by about 15th of January. So please ensure that you're ready. If it opens on 15th of January, you can expect that the internal exams will be held somewhere around the 20th or the 25th of January, so that we can ensure that you do not lose a year. If we delay the exams further, then you may lose a year or lose 6 months in the bargain. So it's better that we have your exams as early as possible. Get ready for the final examination, which will possibly be in the month of February. So please get ready and be aware of what's going on. Now, coming down to the topic, investigation of an epidemic. We are today in the middle of a pandemic. So please remember, these are different words, 2-3 words which are there. I don't know whether I have it in my presentation, but let me mention 2-3 words. One is an epidemic, second is an endemic, and third is a pandemic. One is outbreak, and second is a disease which is okay. So let's go into what are all these words. Is there any difference between an outbreak and an epidemic? Yes, there is a difference between an outbreak and an epidemic. We have dealt with how different types of epidemics are there earlier. Point source epidemic, propagative epidemic. We have dealt with all these things. If you do not remember, please read it up. Always better to read up all these things in continuation. So read up about types of epidemic which I've already taught you, and come down now and read up again. Once I finish this lecture, read up again about investigation of an epidemic and be clear about it. When a disease is locally present throughout the year, throughout all seasons, it is called an endemic disease. It is there throughout the year. Examples: you've got malaria present throughout the year. Throughout the year, you have got malaria present in India everywhere. Nowadays, malaria is coming down. That will be taught to you by somebody else, possibly, or I may teach you a revision, that is. And so, this a disease which is present throughout the year in a population is endemic to that population. A disease which comes suddenly is likely to be a outbreak. When the outbreak is continuous and spreads to a larger population, then it is called a epidemic. When it is there in one state or one country, then you're talking of an epidemic. When it spreads from country to country, that means it has the cases are there in numerous countries, it is spreading in numerous countries, then you're talking about a pandemic. Is that clear? Outbreak, epidemic, endemic, and pandemic. These few words, please remember. Okay. Also, many a time you were asked to give a definition of the word epidemic. So, the unusual occurrence in a community or a region of disease, specific health-related behavior. In this form it is coming. Okay, I'll just a minute. Settings will change. Now it's okay? No, it'll come, it'll take time. Now it's okay, okay. Okay. The unusual occurrence in a community or region of a disease, specific health related behavior. You see, you need not have an epidemic of say COVID. You can have an epidemic of smoking. You can have an epidemic of traffic accidents. So it is unusual occurrence in a community of a region of a specific health related of a disease or a specific health related behavior or health related event, clearly in excess of expected occurrence. So the key words are: one, unusual occurrence. Second is in a community or region, and third is excess of expected occurrence. Now these all we will talk about in a little bit detail in the next few slides. So what happens whenever we're talking about disease occurring? It is basically an interaction between the agent, host, and environment. We talked about this triad which is there. We'll keep remembering about these triad: agent, host, and environment. And when the agent, host, and environment are in typical balance, you don't have any disease. Whenever there is an imbalance, you have disease occurring. So whenever we talk of an epidemic, we whenever we talk of an epidemic, you must remember that there is an unusual occurrence. So there is an increase in incidence. So we'll be talking about that in future. But when we are doing an epidemic investigation, what are we planning to do? We want to know how big is this epidemic, so that we can bring resources to control the epidemic. What is the magnitude of the epidemic? Determine particular conditions which are responsible for why is it that this epidemic has taken place. What is the reason for this epidemic? We want to identify the cause, the source, and the mode of transmission. That is how, once you know the cause and the mode of transmission or the source, then only you will be able to control the disease. See, for example, ideally, you all have come at a time when we've had this COVID pandemic, so you will be able to understand it very well. You should understand that unless and until we knew what was the cause was the COVID virus. Where was the source? Source was, initial source was say Wuhan or wherever it was. It is then being transmitted from person to person. So the source is known. What is the mode of transmission? Can it be transmitted through the oropharyngeal route? Yes, it was being transmitted by the oropharyngeal route. So if you have another disease which is not transmitted by the oropharyngeal route, what are the other modes of transmission? It can be transmitted, for example, in case of hepatitis B. Well, how is it transmitted? It is transmitted by the sexual route. It is transmitted by fluids, blood and various other body fluids. So you have different modes of transmission which can cause an epidemic. Make recommendations for preventing the recurrence of the disease. That is most important, because now, for example, in COVID, we have this thing which is there. We know how the transmission is taking place. We know a few measures to control it, but the further means of prevention of the disease and how to prevent it in future is what is most important. First is, of course, the first step which we do whenever we get a call that there has been an outbreak. Now I'll call it an outbreak first, then we'll call it an epidemic. So first and foremost, when we know, like for example, in Andhra, we have had a large number of people who are suffering from a peculiar disease which results in convulsions. And it's not one or two, it's 400, about five, at last count, it was somewhere to the tune of 525 cases which have occurred. Cases which have occurred in and around Eluru, where you have about 525 patients of a peculiar disease which causes convulsions. Now, when you start looking at that, you say there is an outbreak. So, the first step which is there in this epidemic investigation is to go there and see what these cases are. Define the case. One case, the case in this particular case, the case will be any individual who is reported with unexplained convulsions. There will be many other features. Maybe there is fever with it, maybe there is vomiting with it, maybe there is convulsions is associated with some other things. But we have to first and foremost is to go and diagnose that these cases are there. At this point of time, we will take clinical samples. Large number of samples will be taken. Now, when you talk about, say, for example, in this case, we're talking about this AP outbreak, we have convulsions taking place. And in convulsions, normally what are the investigations which are done? Normal investigations we would like to do is to first of all take a proper history to check whether the person has had any infective cause. That will involve whether the person has fever, whether the person has any cough. All these things will point to an infective cause. After we have taken the history, we would do an examination, check for signs of meningitis, meningism. I will not going into details as to exactly how we do it, whether we took the Koenig sign, whether we take various other signs which are there, straight leg raising test, various other tests which are there which we can do to check whether there is meningitis or meningism. Then after that, we will do a complete neurological examination of the patient to find out if there is any neurological loss. After that, we will come to lab investigations. The lab investigations which we need to do in any case of, for that matter, of a person who is suffering from convulsions, is you do a series of blood tests to check whether the person is suffering from any systemic infection. I'm not going into details of that. Second is that you would like to do a CSF examination to check whether there is any viral infection, bacterial infection, or any other problems which are there. The other examinations which you would like to do is you would like to do an ophthalmoscopic examination to check whether there is any increase in intracranial pressure, which then you would also like to do an X-ray of his skull to see whether he has any injury which is causing any damage, or see whether it is a X-ray or a CT, which will show any increase in intracranial pressure, whether there is any bleed or any other cause for the particular convulsions. There'll be various other lab investigations. I'm not going into details. Basically, we are going to do the lab investigations to come to a diagnosis. Okay. Once we have verified the diagnosis, in this case, in AP investigation is still on. No diagnosis has been confirmed. They only know that the person suffers from. So they have found, in some cases, they have found an increase in the amount of lead, or they found some other compounds which are high in the blood. They are unable to find out. Then also the samples will be taken from as to what the person has consumed, whether he has those all will come to those. So first is to verify the diagnosis. Once the diagnosis has been verified, we will confirm the existence of an epidemic. See, many a time we jump to the conclusion that there is an epidemic. I mentioned about malaria. Many a time that is the getting about a few cases of malaria, people jump to the conclusion that we have an epidemic of malaria. No, not necessary. It is very essential that we compare the data of last year and this year, of the same months, because there are seasonal variations which happen. Example, dengue. Dengue occurs only, mainly, not only, mainly during the post-monsoon period, when desert coolers, etc., which have got water, are not being used, when there is collection of water in tires, when there is collection of water in near houses. So there Aedes mosquito will breed, and hence there is a dengue number of cases increase just after the monsoon. But is it an epidemic of dengue? It will be called an epidemic if we compare the data with the previous 3 years, and we compare the data throughout the year or the previous 3 months. So two things to be done: previous years and previous months, few months data requires to be compared to confirm that there is a epidemic. Okay. The next is that we take a map of the area. A map of the area is taken. We mark out on that map where all the cases have occurred. The classical case of mapping which was done by John Snow. Initially, John Snow did a mapping of the area in London, where I mentioned this story a number of times to you all. I'll mention it again because I found that examiners love to ask about John Snow. So let me tell you the story again, where we have John Snow, who is the physician to the Queen of England. He is also known as the first epidemiologist. Why? Because when he was treating patients in London, he found that the large number of cases were occurring in a particular location. He took a map, and just like what we are trying to tell you, he put the map on the ground and marked out each case where it was occurring on the map. When he found that there was a large number of people who were getting cholera, who were there from Oxford, or Broad Street as it was called, Broad Street, while the rest of the area there were cases which are occurring. but there was much less casing. There was a clustering of cases which took place near the Broad Street. And then when he went to see, he found that there was one pump which was supplying water to all these particular areas, called the Broad Street pump. What did Jon Snow do? Jon Snow told the queen and told the people around that please don't have water from here. But when there is no other water source available, what will people do? They'll say, this chap is talking nonsense. We don't think so. We think we will continue. The water appears very clean. So they continue to have water from the Broad Street pump. They continue to suffer from the disease until Jon Snow got fed up. He said one night he went and took the handle of the pump and hid it. And so what did the queen do? The queen ordered that we have heard that Jon Snow was doing all these things and was telling people not to have water from the pump. He must be having the handle of the pump. They searched for him. He says, I got the handle, but I'll not give it to you. They put him into jail. They put him into jail. He was there for a few days, by which, those were the days when making a handle of a pump also was a big thing. So it would take a number of days for the handle of the pump to be made. And so in those days that he was in the jail, the number of cases of cholera decreased, showing that possibly this was the cause of the people suffering from cholera. So that is the reason why Jon Snow is known as the father of epidemiology. So what did he do? He made a map, and this map we call a spot map. We put spots on that map. Where patients are located, we put spots. And we also count the entire population. We do a survey, of house-to-house survey, to find out whether there are more cases. That is what is called counting of the population. We do a rapid search for all cases in the area, as I just mentioned. A medical survey is done to find out if there are more cases in the area. And for each of these cases, we will make out an epidemiological case sheet. Now, what is an epidemiological case sheet? I think we move out from Jon Snow, move down to the current situation of COVID. When we look at COVID, what is supposed to be done? Please do not think that what was done in Telangana was ideal. What was done in Medicity was ideal. Forget about it. What is supposed to be done? Whenever you have a COVID case, whenever a COVID case was there, you were supposed to write the complete history of that patient. After writing the complete history of the patient, we are supposed to have a chart which shows his contacts in the last 14 days. Once you have that, whom he has contacted in the last 14 days, then you do what we call a contact tracing. You go and trace the contacts, and once you trace the contacts, you find out whom else they have met, and the contacts of the contacts will also be traced. And in that case, you will come to know how the disease could have spread, and these people for the contacts would also be tested for the disease. So this is how an epidemiological case sheet and contact tracing will be done. So also we would look for new cases, which we are doing at the present moment. We are looking for new cases of COVID, and this search is supposed to be an active search. Currently we are doing a passive search where we wait for the patient to come to us. An active search would be, we would go to the population, go house to house, and check out whether there were cases or not. After we have done that, we will get the data and we'll analyze the data. What have we done in the epidemiological case sheet? We have asked them, when did he get the symptoms? We have asked him what he did the last 14 days. We have asked him where he got the disease, And since we got the list of as far as the person is concerned, we'll find out what are his symptoms, how has he looked after it, how has he isolated himself, what are the other things which he has done. Okay, depending on the disease, we'll ask the questions. And all this data is then analyzed, and you try to identify a common event or experience to delineate the group involved in the common experience. So any person who has been to a marriage party, so from that you've had COVID cases. So you will take the complete list of the marriage invitees, interrogate them, investigate them, and come to analyze the data as to with the time, place, and person distribution to find out how the disease is being spread. Once you do that, you will find out that there is a clustering of cases. So you prepare a chronological distribution of dates and construct an epidemic curve. Epidemic curve need not look like this. The epidemic curve of COVID shows that it went up in the epidemic curve in COVID in US for that matter. It went up, came down a little, and went up again. There are bimodal, trimodal. There are so many types of presentation which can occur depending on whether you are putting any preventive steps in place. Over here in this particular slide, they must have put some preventive steps. So that's the reason why the steps must have been put just before the graph has peaked. So once the preventive steps have been put, the decline of cases can occur. So the epidemic curve suggests the time relationship with exposure to suspected source. Whether it is common source or propagated epidemic, you'll come to know from that. Whether it is seasonal or cyclical, again you will come to know from this particular graph. A place distribution, we mentioned about spot maps. So you can then start looking, once you do have a spot map, what could be the connection, whether there's a connection with the water supply, whether there's a connection with air pollution, or foods which are eaten, or whether these people are going to one particular occupation only. Clustering of cases indicates common source of infection. Person, as I mentioned, you analyze the data by age, sex, occupation, other possible risk factors. So this is how a spot map looks like. You get the map of the area and then keep putting spots wherever there are cases. After you've done all that, you formulate a hypothesis. You say, okay, COVID, or for that matter, the Andhra outbreak which is there, which has got so that could be transmitted through water. Water may be the cause. People must be drinking. So many people are drinking the same water. So possibly it could be. Or there's another theory which says it could be the milk from a particular dairy farm. They are having from that particular dairy farm. That's the reason why they're suffering from it. This is my hypothesis. You can have whatever hypothesis. You can say, yes, you see, all these people get up too early in the morning. That's the reason why they're suffering from all these features. You can have whatever hypothesis you want. There should be some scientific logic for the hypothesis. And when we talked about cause and effect relationship, which is there, I told you, of course, I don't know whether I had a revision lecture of that. I don't think I had a revision lecture. But there are particular guidelines which are there, which state how we should define a cause and effect relationship. So if it has got a plausibility, if it has got a scientific plausibility, if it has got a time relationship, if it has got all the things which we have mentioned in that for the cause and effect relationship, then we can make a hypothesis saying that this is the possible source, this is the causative organism, this is the most possible mode of spread, and these are the environmental factors which have enabled it to occur. So this is the hypothesis which we, whenever you make a hypothesis, you have to prove the hypothesis. So you have to test the hypothesis. So these can be tested by, you check with various attack rates. You compare the attack rates with various groups of exposed and not exposed and suspected factor, and then you can decide whether this hypothesis, whether it's consistent with this hypothesis or is not consistent with the hypothesis. After you've done that, you will also look at environmental and ecological factors which could be responsible for the disease. That's what I said. You'll see the water, so you'll want to test the water. You will want to test the milk. You will want to know where did this infection come from. As far as COVID is concerned, we would like to have had the bats to check whether the COVID came from that. So evaluation of the ecological factors is the next step in investigation of an epidemic. And the primary concern of epidemiologists is to relate the disease to some environmental factor, to know the source of the infection, reservoir, and mode of transmission. Okay? Okay, after you've done that, you will further investigate the population at risk. Basically, you want to find out in these, suppose there's an outbreak of food poisoning, you want to find out if suspected food. You will take feces samples, blood samples, biochemical studies. Also, if you further want to do, like for example is being done in COVID, we would like to do an assessment of the immunity status. This is useful because it permits classification of all members into as to the exposure to specific potential vehicle. Vehicle means water, milk, all these are vehicles of transmission. And you would also like to say, classify the individual based on whether they are ill or not. If they're ill, or if they are ill, then what are the factors which are connected? If they're not ill, what are the factors which are possibly connected? We like to see that. Ultimately, you have to write the report. And very important, to write a good report, you should have the background of the population, geographical location, climatic condition, demographic status, socioeconomic situation, organization of health services in the area, surveillance and early warning systems, and the disease prevalence. The historical data, that is, did they have an epidemic earlier of the same disease or something similar? Or did someone else have in the vicinity? Occurrence of a related disease. If there's a related disease also, one should know whether in the same area or other areas. There's some other disease, for example, in the AP thing, if it was known that they have earlier also had some problems of like this, that would be more important. Then discovery of the first case of the present outbreak. Ultimately, you have to find what we call the index case. The index case is the first case in the outbreak. Then you would like to, in the investigation report, you are defining the case, put the questionnaire used in the epidemiological investigation, and you would like to have the survey tapes, the household survey, the retrospective survey, the prospective surveillance. What is prospective surveillance? From now onwards, I will decide to look at such cases. Then lab specimens which are being collected, and what are the lab techniques being used. The analysis of the data can be clinical data, frequency of signs and symptoms, course of the disease, differential diagnosis, and death or sequelae. All these things will be there in clinical data. Epidemiological data would be on mode of occurrence, time, place, and person. Mode of transmission, that is source of infection, source of excretion, and portal of entry, and factors which influence transmission. These are all things you must ensure that you write in your report. Then you'll write all the lab data which is there, what are the agents which have been isolated, what are the serological tests done, what is the significance of the results, and how you have interpreted the data, the comprehensive picture of the outbreak, the hypothesis which you had formulated, how you tested the hypothesis, And ultimately, you'll come to the control measures. There's definition of the strategies and methods of implementation. What are the constraints and what are the results? The evaluation, significance of the results, the cost effectiveness, and the preventive measures. It's very important that we measure this. That's all that I have for you today. Investigation of outbreak is very, very important topic. You must know it thoroughly. Please read, and if you've got doubts, please ask someone. If you don't have anyone else, please ring me up or ring up any of the faculty in the department. Thank you. Okay. Stop streaming.